Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Swallowing disorders. Introduction. If you have a swallowing disorder, you may have difficulty swallowing and may also have pain while swallowing. Some people may be completely unable to swallow or may have trouble swallowing liquids, foods, or saliva. This makes it hard to eat. Treatment for swallowing disorders depends on the cause. Treatment may include medicines, surgery, or other therapies. This program explains swallowing disorders. It covers general symptoms of swallowing disorders. It also talks about common swallowing disorders and their treatments. Swallowing. People swallow hundreds of times each day. Swallowing is needed to eat foods and drink liquids. It is also needed to move the normal saliva and mucus made by the body. Swallowing is a complex process. About 50 pairs of muscles and many nerves work together to receive food into the mouth, move the food from the mouth to the stomach. There are 3 stages of swallowing: oral, pharyngeal, esophageal. During the oral stage, food or liquid is prepared for swallowing. The tongue and jaw move solid food around in the mouth so it can be chewed. Chewing makes solid food the right size and texture to swallow. Chewing also mixes the food with saliva. Saliva softens and moistens the food to make swallowing easier. At the end of the oral stage, the tongue moves food or liquid to the back of the mouth. The pharyngeal stage begins as food or liquid is quickly passed through the pharynx. The pharynx is the area of the throat that connects the mouth to the esophagus or swallowing tube. During the pharyngeal phase, the larynx or voice box also closes tightly and breathing stops. This prevents food or liquid from entering the airway and lungs. The esophagus is the tube that takes food to the stomach. During the esophageal stage, food or liquid passes through the esophagus on the way to the stomach. The esophagus is a muscular tube. The wall of the esophagus is made up of many different layers of tissue that help move the food or liquid to the stomach. Symptoms. Many swallowing disorders have similar symptoms. The main symptoms are an inability to swallow or trouble swallowing liquids, food, or saliva. Other common symptoms of swallowing disorders include coughing or choking, drooling, feeling of food getting stuck in the throat or chest, pain while swallowing. Some swallowing disorders may also cause a hoarse voice, food or stomach acid backing up into the throat, frequent heartburn, pain in the head or neck area such as ear pain, trouble breathing or speaking, unexpected weight loss. Difficulty swallowing can lead to malnutrition and dehydration from not being able to get enough food and liquids. Respiratory problems if food or liquid gets in the airway. If you notice any of these symptoms or other changes, talk to your healthcare provider.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Anyone can have a swallowing disorder, but it is more likely to happen to the elderly. Swallowing problems often happen because of other conditions. Any condition that weakens or damages the muscles and nerves used for swallowing may affect swallowing. For example, people with diseases of the nervous system often have problems swallowing. These diseases include Parkinson's disease and cerebral palsy. Parkinson's disease, or PD, is a type of movement disorder. It happens when nerve cells in the brain do not make enough of a brain chemical called dopamine. Sometimes it is genetic, but most cases do not seem to run in families. Exposure to chemicals in the environment might play a role. Symptoms of PD begin gradually, often on one side of the body. Later, they affect both sides. PD can cause difficulty swallowing, as well as poor balance and coordination, slow movement, stiffness of the arms, legs, and trunk, trembling of hands, arms, legs, jaw, and face. Cerebral palsy is a group of disorders that affect a person's ability to move and to maintain balance and posture. The disorders appear in the first few years of life. They usually do not get worse over time. Cerebral palsy happens when the areas of the brain that control movement and posture do not develop correctly or get damaged. In addition to trouble swallowing, people with cerebral palsy may have difficulty walking or problems with everyday tasks. Some have other medical conditions, including seizure disorders or mental impairment. Additionally, stroke or head injury may weaken or affect the coordination of the swallowing muscles. They may also limit sensation in the mouth and throat that helps a person swallow. People born with certain abnormalities may not be able to swallow normally. For example, babies who are born with a cleft palate are unable to suck properly. This causes problems with nursing and drinking from a regular baby bottle. Other conditions that can cause swallowing problems include cancer of the head, neck, or esophagus. The treatment for these types of cancers may affect swallowing. Infection or irritation of the esophagus. Problems with the esophagus, including GERD. GERD stands for gastroesophageal reflux disease. If you have heartburn more than twice a week, you may have GERD. It is the most common disorder that affects the esophagus and can cause swallowing problems. GERD happens when the muscular ring at the end of the esophagus does not close properly. This allows stomach contents to flow back or reflux into the esophagus and irritate it. GERD can cause damage to the esophagus over time, which makes swallowing more difficult. Diagnosis. Your healthcare provider will first ask about your symptoms and medical history. A physical exam will also be performed. Tests can help your healthcare provider determine what is causing your swallowing problem. These tests include barium X-ray, dynamic swallowing study, endoscopy, manometry. For a barium X-ray, you will drink a liquid containing barium. The liquid coats the inside of your esophagus. This makes the esophagus show up better on X-rays. It lets your healthcare provider see changes in the shape of your esophagus and how your esophagus works. You may also swallow solid food or a pill coated with barium. This lets your healthcare provider watch how the muscles in your throat work as you swallow. It can also reveal small blockages in your esophagus that the liquid may not find. A dynamic swallowing study involves swallowing different foods coated with barium. Your healthcare provider can see how the food travels from your mouth to your stomach. This test also shows if any food goes into the breathing tube. An endoscopy uses a thin, lighted tube to look inside the esophagus. The tube is inserted through the mouth. Your healthcare provider may use a smaller tube inserted through the nose. Manometry may also be done. This test measures the muscle contractions of the esophagus as you swallow. It uses a small, thin tube inserted into the esophagus. The tube has a pressure recorder attached. Other tests may also be needed. Your healthcare provider will explain any test you have before it is done. Treatment. Treatment for swallowing disorders can vary depending on the specific disorder. Treatment may include medicines, therapy, and even surgery. Medicines can help a lot of people with swallowing disorders. Medicines may reduce acid, relax muscles involved in swallowing, slow stomach acid production. Sometimes lifestyle changes can help. These may include eating small meals frequently throughout the day instead of eating large meals, eating at least 2 hours before bed, elevating the head of your bed about 6 inches, losing weight if you are overweight or obese, quitting smoking. Preparing food in a certain way or avoiding certain foods may help in some people. For instance, people who cannot swallow thin liquids may need to add special thickeners to their drinks. Other people may have to avoid hot or cold foods or drinks. Therapy can be used to help strengthen facial muscles or improve coordination. It can also help in learning to eat in special ways. For example, some people may have to eat with their head turned to one side or looking straight ahead. In some cases, it may not be possible to continue eating by mouth. Other methods are then needed to keep the body nourished and healthy. Usually, this involves a feeding system, such as a feeding tube that bypasses or supplements the part of the swallowing mechanism that is not working normally. Depending on the cause, other treatments may also be needed. For example, treatment for cancers of the head, neck, and esophagus may involve surgery, radiation therapy, chemotherapy. Talk to your healthcare provider to learn what treatment plan is best for your condition.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. If you have a swallowing disorder, you may have difficulty swallowing and may also have pain while swallowing. Some people may be completely unable to swallow or may have trouble swallowing liquids, foods, or saliva. This makes it hard to eat. Swallowing disorders are more common in the elderly. Swallowing problems often happen because of other conditions, including head or spinal cord injury, nervous system disorders such as Parkinson's disease and cerebral palsy, problems with your esophagus, including GERD, cancer of the head, neck, or esophagus, stroke. Treatment for swallowing disorders depends on the cause. Treatment may include medicines, surgery, or other therapies. You may find it helpful to change your diet or hold your head or neck in a certain way when you eat. In very serious cases, people may need feeding tubes.
Thank you for using Explain.